to my channel. So let's start the chapter number 2 of the revision notes of MRCOG part 1. So this chapter is related to the embryology. So let's start embryology, and the first topic is the embryogenesis. Definition is the zygote is a fertilized ovum, and embryo is considered when of gestation age is 2 to 8 weeks following the fertilization, and fetus is 9 weeks onwards to the term. And chronological post fertilization, first is the fertilization. It occurs at the ampulla of the fallopian tubes, and it occurs 12 hours post ovulation. And second meiotic division is complete following the fertilization, and first mitotic division is completed at 30 hours post fertilization. Chronologic in the first week of the life, the day 2 is the zygote. Zygote is 2 cell stage. Day 3 morula is 16 cell stage, and it reaches the uterine cornu. Day 4 is the blastocyst stage, and it enters the uterine cavity, and day 6 is the implantation begins. Then the blastocyst, it is composed of an inner cell mass known as the embryoblast, which later forms the embryonic tissue, and an outer layer of the cells known as the trophoblast, which last forms the external embryonic tissue, for example the placenta. It comprises of the 70 to 100 cells, has a fluid filled cavity known as the blastocele, and prior to the gastrulation, the trophoblast differentiates into 2 cell lineages, and an outer syncytium, also known as the syncytotrophoblast, and inner layer of the cytotrophoblast. Day 2 is the zygote, 2 cell stage. Day 3 is the morula, 16 cell stage, and which is the uterine cornu, and day 4 is the blastocyst stage, which enters the uterine cavity, and day 6 the implantation begins. And then the fetal development in the second week of the life. Day 8 the decidual reaction they occurs, and the bilaminar disc it forms, and amniotic cavity it forms. Day 9 is the lacunar stage, and the exocoelomic membrane formation, and day 12 includes the lacunar formation. Extraembryonic mesoderm appears, and the extraembryonic coelom forms. Day 13 implantation is complete, and primary chorionic villi they form, and chorionic cavity they appears, and the uterine uteroplacental circulation it begins. Then second week of the gestation, it includes the day 8 to 14, and day 8 includes the decidual reaction it occurs. Implantation initiates, as we have discussed here as well. The implantation then initiates the decidual dualizations of the endometrial stroma and formations of the embryonic laminar disc, and the amniotic cavity they develops within the epiblast. Then the bilaminar disc is derived from the inner cell mass. Embryoblast is composed of the epiblast and the hypoblast. Epiblast is the dorsal germinal layer, and the hypoblast is the ventral germinal layer. Day 9 is the lacunar stage it begins, and the hypoblast they forms the exocoelomic and Husser's membranes that lines the yolk sac. Then day 12 the formations of the lacunae in the syncytotrophoblast, which communicates with the endometrial sinusoids, and the extraembryonic mesoderms they derive from the yolk sac cells they forms, and extraembryonic coeloms they forms, also known as the chorionic cavity, and they forms by the lacunae which appears within the extraembryonic mesoderm between the extracoelomic membranes and the cytotrophoblast at merge. And day 13 it implantation complete, and the cytotrophoblast they forms the primary chorionic villi, and the yolk sac is called the secondary sac due to the presence of the chorionic cavity. Then the connecting stalk that connects the embryo to the cytotrophoblast, and it is derived from the extraembryonic mesoderm, is the forerunner of the umbilical cord. Third week of the development, it includes the day 15, in which there is a primitive streak that appears at the caudal end, and the primitive node appears in the cephalic end of the streak, and the ectoderm the cells they migrates towards the streak and detaches from it, spreads out laterally, and beneath it to form the intraembryonic mesoderm. Intraembryonic mesoderm lies between the ectoderm and the endoderm, and they expect in the two locations where the ectoderm they meets the endoderm. The procaudal plate, the buccopharyngeal membranes, and the cloacal plate. The buccopharyngeal membranes they breaks down at 4 weeks, and the cloacal membranes they breaks down at the 7 weeks. The notochord formations, the cells they form, the primitive node migrates cranally towards the procaudal plate, and this forms the notochordal plate with the which becomes the future notochord. Day 16. Allantois, the allantoenteric diverticulum appears. Allantois is the diverticulum that forms from the posterior wall of the yolk sac and extends into the connecting stalk. And the neurulations, the process of the formations of the brain and the spinal cord, and the neural plate is formed at the day 18, and the primitive heart tube forms at the day 20, and first heartbeat is noted at the day 21. Day 15, the primitive streak and the node forms, and the gastrulation say starts, intraembryonic mesoderm forms, and the notochord forms. Neurulation, there occurs the neural plate forms, and the intraembryonic coelom forms, and the first pair of the somites they form, primitive heart tubes they forms. Then the gastrulation, it is the formations of the three germ layers and occurs in the third week of the development, and the ectoderm they give rise to the intraembryonic mesoderm, and the components they derive from the ectoderm, mesoderm, and endoderm. And embryo folds occurs in the two plates, longitudinal due to the enlargements of the cranial and transverse due to the enlargements of the somites. And components derived from the ectoderms, mesoderm, and endoderms. The ectoderms is the epiderms and neural system, the mesoderm the muscle, skeletal, and connective tissue, and the endoderm GIT, respiratory tract, endocrine glands, and the auditory system and the urinary system. The fetal development from the week 4 to 7, from day 22 to 28, the septum primum appears, and the brachial arteries they forms, and the neutral tubes they closes, optic pits appears, pulmonary perimodium appears, and the hepatic plate appears, and cystic diverticulum they forms, and the dorsal pancreatic they burst they forms, the spleens they forms, and urorectal septum they appears, and the ureteric burst they forms. Week 5, the lens pit and the optical cups they forms, and the nasal pits they forms, and leg bursts they form. Rudimentary blood moves through the primitive vessels connecting to the yolk sac. Week 6, it is the lung begins to they form, and the lymphatic system they begins to form, and the gonadal ridges they begin to perceptible. And week 7, the fetal heart tone the audible, nipple they form, hair follicle they begin to form, and the spontaneous limb they movement they can detected by the ultrasound. And the fetal development from the week 7 to 20, the eyelids they closes and will not reopen until the 28th week, and tooth buds they appears, RBCs they are the produced in the liver, and week 11 to 14, lungo they disappears, and the fetal skin is transparent, and the meconium they form in the intestinal tract. Day 17, the eyebrow and the eyelashes appears, and the nail appears, quickening occurs, and the week 21, alveoli they form. The fetal development from the week 25 to 27, and mesoderm. The mesoderm they has the three parts. The somites they are the round elevations of the paraxial mesoderm, which appears on either sides of the neural tube, and under the surface ectoderm on the dorsal aspects of the embryo from the base of the skull to tail region. First pairs they appears at the day 20. The maximum number is the 42 to 44 pairs, and it consists of the dermomyotomes from the connective tissues and muscles, and the sclerotomes which forms the bone. And the lateral plate mesoderm is continuous with the extraembryonic mesoderm. They gives rise to the somatic mesoderm. They lines the amnion, and the splanchnic mesoderm they lines the yolk sac. Intraembryonic coelom, it is formed on the day 19, is formed from the merging of the clefts within the lateral plate, and is continuous with the extraembryonic coelom, is the forerunner of the serous cavities. Week 25 includes the fetal length 38 cm and fetal weight 1.2 kg. Week 29, The fetal weight 2 kg and a rhythmic breathing the movement occurs. Week 33, fetal length is 40 to 48 centimeter and fetal weight is 2.5 to 3 kg, and week 34 to 37, the fetal length is 48 to 53 centimeter. Now the parts of the mesoderm: the paraxial mesoderm, which is the segmental and they forms the somites, and the intermediate mesoderms, they forms the urogenital system, and the lateral plate mesoderm, they forms the somatic and the splanchnic mesoderms. Placenta and the fetal membranes. The general fact: the embryonic nutrient requirements during the fertilization and the initial blastocytes, the formations and nutrients, they are obtained by the diffusions, and by the zona pellucida, they form the accumulated fluid in the blastocoel. From day 12 to term, the embryo, they obtain the nutrients from the maternal blood via the uteroplacental circulation. The endometrial stromal cells, they become large and accumulate the glycogen in the response to circulating progesterones and the blastocysts. Then the decidual reactions, they are the cellular changes at the site of the implantation, which includes the syncytial trophoblast, includes the adhesions of the endometrium and endometrial tissue edema, endometrial cell shape becoming the polyhedral, and increase in the endometrial cell glycogen and lipid depositions, and increase in the endometrial vascularization, and occurs at the day 12 of the embryonic life. In pregnancy, the decidua endometrium, it is definable as the three discrete layers: the basalis, such that where the implantation take place and the basal plate is formed, and the capillaris, the ovaries overlies the chorion, and the parietalis, they covering the rest of the endometrial cavity expecting the implantation site. Capsularis and the parietalis, they comes in the contact with each other and the obliterate the uterine cavity at 4 months of the gestation. History of the early pregnancies characterized by the presence of the chorionic villi, decidua, trophoblast, fetal membranes, fetal somatic tissue. The presence of the decidua on its own is a historical sample is not enough to confirm a diagnosis of the pregnancy. Aries stella, they are the changes in the endometrial glands due to the effects of the progesterone. Placenta. The placenta has both the maternal and the fetal components. The maternal parts, they are derived from the decidual basalis, and the fetal parts, they consist of the villi of the chorion frondosum. The placenta is structurally composed of two units: the chorionic plate and the basal plate. Basal plate is the region of the placenta on the maternal side. Then the chorionic plate is of the fetal origin and is composed of amnion, extraembryonic mesenchyme, and the cytotrophoblast and the syncytiotrophoblasts. The basal plate of the placenta is made up of the fetal derived parts from the cytotrophoblast, syncytiotrophoblasts, and the maternal derived parts. Villi are the chorionic projections suspended in the intervillous space, and the purpose is to maximize the area of the interchange with the maternal blood. Each contains a capillary plexus supplied by the branches of the umbilical vessels, and interchange occurs with the maternal blood brought to the intervillous space by the branches of the uterine vessels. The development of the chorionic villi. The day 12, formations of the primary chorionic villi, and the cleft appears in the syncytiotrophoblasts, they call the lacunae, which communicates with the maternal endometrial sinusoids, and the cytotrophoblast, they forms the primary chorionic villi. Day 15, the formation of the secondary chorionic villi and extraembryonic mesoderms invades the core of the primary chorionic villi, converting them into the secondary chorionic villi. Secondary villi, they line the entire chorion. Day 21, the tertiary chorionic villi, they form. Tertiary chorionic villi are villi containing the blood vessels. Day 28, free villi forms, and the cytotrophoblast in the tertiary villi disappears. Chorion, they leaf is formed from the chorionic villi located on the anembryonic pole. These parts, they compressed against the decidua capsularis and become the avascular. Chorion de frondosum, they is located at the embryonic pole. Tertiary villi of the chorion frondosum, they grow towards the basal plate and attach to the decidual tissue by the cytotrophoblast shell, also known as the anchoring villi. Anchoring villi, they give rise to the side branches called the intermediate villi, which in turn they produce the terminal villi, and terminal villi they develop as sprouts of the syncytial trophoblast, take over the functions from the intermediate villi in the third trimester of the pregnancy. Placental villi maturation they includes a capillary enlargement, thinning of the syncytial trophoblast, and the cytotrophoblastic disappears. Intervillous space is a blood-filled space between the anchoring villi, also known as the trophoblastic lacunae. Development of the cytotrophoblast blast layer and the forms by the cytotrophoblast of the anchoring villus, which expands into the basal plate until a future layer outside the syncytial trophoblast arises, penetrates in the decidua and the myometrium, and colonizes the wall of the spiral arteries, leading to the destructions of the smooth muscle layer and the changes in the elasticity of the spiral arteries. This migration is used under the strict temporal spatial control. Insufficient penetration they lead to the preeclampsia, and excessive penetration leads to the chorion carcinoma. Placental septa, also known as the intercotyledon septa, arises from the decidua at 4 months of the fetal life and divides the placenta into 15 to 20 lobes, do not reach the chorionic plate. Placental membrane, it is a partition between the fetal and the maternal circulation, and is composed of the fetal tissue that initially 4 layers thick, and the layers they are the fetal capillary endothelium and the connective tissue of the villi and the cytotrophoblast and the syncytial trophoblast. From 4 months of the fetal life, the placental membrane they become the thinner due to the villus maturations. And then moving towards the umbilical cord, the dimensions at the terms, the length is 50 to 60 centimeter and the diameter is 1.5 to 2 centimeter. It contains the 2 umbilical arteries and the 1 umbilical vein and the Wharton's jelly. 1:100 newborns they have only 1 umbilical artery, and 20% of them they will have a coexisting vessels or the heart abnormality, usually inserting in the placenta near the center, but other insertions includes the eccentric. The cord insertions is of the center and up to 2 centimeter away from the edge. The marginal, the cord insertion from the within the 2 centimeter and up to the edge of the placenta. And the vella mentions the cord insertion into the membranes and then travels within the membranes to the placenta. The exposed vessels they are not protected by the Wharton's jelly. No, so what is a Wharton's jelly? Wharton's jelly is made up of the mucopolysaccharides, and it is derived from the extra embryonic mesoderm, and it protects the umbilical blood vessels and contains the fibroblast and the macrophages. Now, the fibroid deposits accumulate in the placenta. That begins from the 4 months of the fetal life and occurs in the 3 regions of the placenta and subchoroid Lacan's layers within the chorion plate, and the rows layers beneath the stem with the villi within the basal plate, and the netta box layers in the deciduous basalis within the basal plate, and this is the layer where the placenta detaches at the birth. Can take up a maximum of the 30% of the placental volume without affecting its functions. The fetal membranes, it is term applied to the structures derived from the blastocysts that do not contribute to the embryo, are made up of the 4 components. And the amnion cavity is formed by the day 7 of the embryonic life and has the 5 layers: the cuboidal epithelium, the basement membranes, the compact layer, and the fibroblast and the spongy layer, remnant of the extra embryonic coeloms, and does not contain the blood vessels. The components of the fetal membranes: the amnion, it is the inner side is formed from the ectoderm and the outer side is formed from the mesoderm. Chorion, the double layered membrane, they formed by the trophoblast and the extra embryonic mesoderm, and the yolk sac they become incorporated into the GIT, and the allantois is the diverticulum of the yolk sacs, and become attached to the urinary bladders. And then the chorion is composed of the 4 layers: the cellular layer, the reticular layer, the basement membranes, and the trophoblast. Sharing of the placenta and the fetal membrane in the twins depends on the stage at which a single zygote is derived. If the two types of the twins are monozygotic, diazotic, the diazogotic constitutes the 70% of the pregnancy. Monozygotic twins, they can be DCGA, which is a separation Which is dichorionic diamniotic. Its separation occurs at the medulla stage by the day 3, and the monochorionic diamniotic separations occurs at the 4 to 8 days. Accounts for the 70% of the monozygotic twins, and the monochorionic monoamniotic. It is separation occurs after the amnion is formed, and between the days 9 to 12 accounts for the 1% of the monozygotic twins. Conjoined separation, they occur at the day 12, and the incidence is 100,000 pregnancies. All dizygotic twins are the dichorionic. 3% of the monochorionic twins have the two placental masses, and the chorionicity is better determined by the ultrasonography before the 14 weeks gestation. Lambda sign indicates a dichorionic diamniotic, and the T sign indicates a monochorionic monoamniotic. Stage of the dizygotic divisions are the resultant types of the twinning. The splitting at the morula stage, such that the day 3 it is the two amnions, two chorions, two placenta. Splitting of the inner cell mass within the single blastocyst at the day 4 to 8, then the two amnions, one chorion, one placenta. Splitting up after the formations of the bilaminal disc, which is J9 to 12, then one amnion, one chorion, one placenta. Day 12 is a one amnion, one chorion, one placenta. And now moving towards our next topic, these are the placental disorders. Number one is a molar pregnancy. It is characterized by the presence of the herediform mole, and the prevalence in the UK is 1 ratio 714 live births, and categorized into two groups: the complete moles and the partial moles. Complete moles includes characterized by the diffuse swelling of the villus tissue and diffuse trophoblastic hyperplasia in the absence of the embryonic fetal life, and it occurs when an empty egg is fertilized by one or two abnormal normal spermatozoa. Dispermic fertilization is less than 20%. They are the diploid, and the genotype is 46XX and 46XY. All nuclear genes are the paternal. And now the partial moles, it is characterized by the focal swelling of the villus tissue and focal trophoblastic hyperplasia in the presence of the embryonic tissue, and occurs when a normal haploid egg is fertilized by the two or the three spermatozoa are triploid, such that contains three sets of the chromosomes. The genotype is in the decreasing order of the frequency: 69XXY, 69XXX, 69XYY. Prognosis: 80% of the herediform moles, they are benign, and 15% will develop into the invasive moles, persistent trophoblastic disease, and 2 to 3% they may develop into the choriocarcinoma. Next is the placenta accreta. Occurs when the placenta is morbidly adherent to the myometrium due to the deficient deciduous bizalis. The placenta increta is the term applied when the placenta invades the myometrium but has not breached the uterine serosa. The placenta percreta is the term applied when the placenta breaches the serosa of the uterus, and the censurates lobes is defined as one or more accessory lobes of the placenta that are attached to the bulk of the placenta but by the blood vessels running through the fetal membranes. Twin to twin transfusion syndrome, it is due to the abnormal connecting blood vessels, atrioatrial and the veno-venous anastomosis in the twins placenta, resulting in an imbalanced flow of the blood from one twin to other. Risk of the twin syndrome is in the monochorionic twins 15%, and the more common in the monochorionic diamniotic than the monochorionic monoamniotic twins. Treatment is the fetoscopic laser ablations of the interconnecting blood vessels, and the severity is graded with the Quintero classification. The body cavities and the diaphragm. The embryo, they takes a three-dimensional shape during the fourth week of the development by the folding, resulting in the formations of the GIT and the conversions of the intraembryonic cilium into a closed cavity. And Quintero classification it further includes a discrepancy in the amniotic fluid volume, and the bladder of the donor twin is not visible by the ultrasonography. Stage 3, the critically abnormal abnormal fetal Doppler studies, and the fetal hydrops presence, and the demise of one or both twins. The body cavities includes the peritoneal, pericardial, and pleural. Arises from the coelomic cavity. They are lined by the two serous layers, and the serous layers of the body cavity includes the somatic mesoderm and the splanchnic mesoderm. Somatic mesoderm is in the contact with the ectoderm, and they give rise to the partial layer of the serous membranes, and the splanchnic membranes they adheres to the endoderm, and they form the visceral layer of the serous membranes. The septum transversum, it is a sheath of the mesoderm, appears on the day 22, is rostral to in front of the developing heart, is the cranial to the pericardial cavity before the folding, and the forms the central tendon of the diaphragm. Intraembryonic coelom before folding appears as a U-shaped cavity. The bend of the U lies anteriorly and represents a pericardial cavity, and each arm of the U represents the peritoneal canal and the peritoneal cavity. In the umbilical region, the peritoneal cavity they opens in the chorionic cavity, allowing the herniation of the midgut to the umbilical cord. After folding, as a result of the head folding, the heart swings ventral to the foregut, and the septum transversum is the wedged before the heart and the yolk sac. Pericardial cavity they opens into the peritoneal canal, which opens into the peritoneal cavity. At this stage, the septum transversum is incomplete partitions between the thorax and the abdomen. The divisions of the intraembryonic coelom forms the four cavities, the two pleural and the one peritoneal and one pericardial. And diaphragm is formed by the five components: septum transversum, the body wall from the somatic mesoderm, the peripheral part of the diaphragm, they attach to the ribs, hence receiving its sensory innervation from the lower six intercostal nerves, and the mesentery to the of the esophagus. They forms the muscular corona of the diaphragm and the pleuroperitoneal membrane, and the cervical somites. During the fourth week of the septum transversum, they lies in the cervical region opposite the third, fourth, and fifth cervical somites, and the myoblasts they form the esomites, contribute to the diaphragmatic musculature, and hence the diaphragmatic innervations is by the nerve C5, C3 to C5. C3 5 uses to form the phrenic nerve. The musculoskeletal system, it is very important. The mesenchyme they give rise to a musculoskeletal system is derived from the mesoderm cells of the somites, and the somatopluric layer of the lateral plate mesoderm, and the neural crest cells, and has the ability to migrate, differentiate into many different cell types. Bone formation occurs via the condensations of the mesenchymal cell, consists of two types of the ossifications, and the exoskeleton is derived from the paraxial mesoderm, which originates as a somites. The types of the ossifications includes that does not involve the cartilage, is responsible for the development of the flat bones, and the endochondral ossifications they occurs by the replacements of the hyaline cartilage, is responsible for the development of the long bones. The vertebral column, the development they goes through the three stages: the mesenchymal condensations around the notochord, the cartilaginous formations, and the ossifications, which starts at the 6 weeks of the fetal life and ends at the 25th years of the adult life. And the vertebral arch they give rise to the costals and the transverse process, and the fuses to form the spinous process, and the formations of the vertebral body depends on the notochord. Formations of the vertebral arch depends on the sclerotome interactions with the surface ectoderm. And intervertebral disc has an outer annulus fibrosis derived from the sclerotomes, and the inner nucleus pulposus derived from the notochords. The vertebrae is intersegmented in the origin due to its formations from the two sclerotomes. The spinal nerves they are segmental. The centrum vertebral body formations by the sclerotomes, and the vertebral arch formations, and the spinous process formations due to the vertebral arch fusions. Now the sternum, Sternum they develops from a pair of the cartilaginous bars that form the ventral body wall, and these bars they fuses in the midline in the craniocaudal sequence. Ribs they arises from the costal process of the vertebrae and they grow laterally towards the sternum. Skull is composed of the neurocranium which surrounds the brain, and the viscerocranium which surrounds the mouth, pharynx, and the larynx. The bones of the cranial base they develop from the occipital sclerotomes by the endochondral ossifications, and the skull cap they develops from the mesenchyme of the neural crest by the intermembranous ossifications. The frontinalis they are unossified mesenchymes, and they are the six frontinalis anterior, posterior, two anterior, two posterior, lateral. The most frontinalis they disappears during the first years of the life, and the anterior frontinalis ossifies at the 18 months of the life. Appendicular skeleton in the limbs, the bones they forms initially in the most distal parts. Ossification is by the endochondral ossification, except for the clavicle ossification. The centers first appears at the 8th week of the development, and the shaft of the limb bones they are ossified at 12 weeks of the development. However, the carpal bones they remains cartilaginous until after the birth. Ossifications of the tarsal bones they begin at the 16th week of the development, and smaller tarsal bones do not ossify until the 3 years after the birth. At birth, the shaft, the diaphysis of the long bones they are completely ossified. Epiphyses they still are cartilaginous, and the secondary ossifications they centers they occurs in the epiphyses and a few years from after birth. Muscles, the skeletal muscles they develop from the myoblast derived from the somites, and the head musculature is derived from the pharyngeal arches and the neural crest mesenchymes. Each myotome se divides into the ventral hypomere, which forms the muscles of the anterior and the lateral wall, and dorsal epimere, which forms the muscles of the posterior wall, and the dorsal limb muscles they mass they give rise to the extensor groups, and the ventral limb muscles they mass give rise to the flexor groups. Now the respiratory system, the epithelial components of the respiratory system they develops from the ventral wall of the endometrial lining of the foregut as a diverticulum that grows into the surrounding splanchnopleural mesoderm. The splanchnopleural mesoderm they give rise to the following components of the lower respiratory tract: the visceral pleura, cartilage, smooth muscles, and the blood vessels. The respiratory diverticulum they separates from the foreguts by developing of the bilateral longitudinal ridges called the tracheoesophageal folds, and the tracheoesophageal folds they fuse together to form the tracheoesophageal septum, and it gives rise to the trachea, and the tracheal bifurcation lies at the thoracic vertebral level 4 at the birth, and the lung buds. The larynx it is lined by the epithelium from the endoderm, and the laryngeal cartilage and the muscles they arises from the pharyngeal arches. The lung buds they divide many times to form the bronchial tree. This division is known as branching the morphogenesis, and the right lung buds they derive into three secondary lung buds. The left lung bud derives into two secondary lung buds. The bronchial tree division is not complete until after the birth, and the full lung maturation is reached at the 6 to 7 years of the age. New alveoli continues to be formed up to the 10 years of the age. Lung epithelium it is initially cuboidal and thins with the aging, and the respiration is not possible until the epithelium thins sufficiently to form the squamous. The this begins at the 26 weeks of the fetal life. Consists of two types of the epithelial cells, the type 1 and type 2, and they produce the surfactants. Appears at about 24 weeks of the fetal life. Pleura is composed of the two layers: the somatic layer they formed by the somatopleuric mesoderms, and the visceral layers they formed by the splenopluric mesoderm. Now moving towards the cardiovascular system. One of the first system to develop is the cardiovascular system. In early embryo, nutrients are derived from the trophoblast digestions of the uterine mucosa, and the diffusions from the contents of the yolk sac. Initial components of the cardiovascular systems they appears as the angiogenic cell clusters in the extra embryonic mesoderm lining to the yolk sac. The primitive heart begins beating at the day 21. The heart formations, the angiogenic cell clusters marches in the rostrals to the procaudal plate directions to form the cardiogenic areas, and the cardiogenic cells they form the paired heart tubes, and the dorsal aorta they develops on the either side of the midline and connects with the heart tubes, and the heart tubes they fuses due to the longitudinal and the lateral folding of the embryo. The tube is suspended in the pericardial cavity by the dorsal mesocardium. The dorsal mesocardium they breaks down, leaving the heart attached merely at the margins of the pericardium. The heart tube elongates in the pericardial cavity. At day 23, the elongation is more than the volume available in the pericardial cavity. Hence, the two bends forming the cardiac loop. The bend say occurs at the bulboventricular groove and the atrioventricular groove. Heart tubes they consist of a single atrium and a single ventricle and an atrioventricular canal. Atrioventricular valves they form the regions of the atrioventral canal formed by the endocardial cushions, and the bulbous cordis they lies between the primitive ventricle and the atrial outflow. Proximal third becomes the right ventricle and become the conus cordis, eventually becomes the truncus arteriosus. Atrial septum, the separations they begins at about the 4 weeks, and the septum primum they develops in the roof of the common atrium and grows towards the endocardial cushions, and the ostium primum is the opening between the septum primum and endocardial cushions and closes with the further grows, and the ostium secundum the occurs at the ostium primum closes. It is a small hole in the septum primum, and the septum secundum they forms to the right of the septum primum and grows over the septum primum and does not completely divide the atria, leaving an opening the foramen ovale, and foramen ovale if the function closes occurs at the birth due to the changes in the pressure between the two atria, such that the increased left-sided heart pressures and the decreased right-sided pressure caused by the air breathing and the starts of the pulmonary circulations and become the fossa ovalis after the birth. Ventricular septum is composed of the two components, the muscles and the membranous parts. The components of the ventricular septum, the muscular parts, it develops from the floor of the ventricle, grows towards the endocardial cushions, and this component it does not reaches the endocardial cushions, leaving a gap. Then the membranous part they forms by the endocardial cushions and the aortic pulmonary septum, and the accommodates the atrioventricular conducting bundles. The truncus arteriosus they give rise to the ascending aorta, pulmonary trunks, and the aortic sac. Aortic pulmonary symptoms forms at the week 5, and the forms from the left and the right trunco conal swelling that occurs with the conus cordis and the truncus arteriosus and develops as spiraling structures. The venous drainage of the heart, the sinus venosum, that empties into the common atrium by the single opening, consists of the left horn and the right horn. Right horn of the sinus venous, they become the dominant horn and becomes the proximal part of the inferior vena cava and superior vena cava. The drains the following veins pairs: the common cardinal veins and the vitelline veins and the umbilical veins, and the sinus venarism. Venarum. It is consists of the right horn of the sinus venosum and the vena cava and lies on the posterior arterial wall. And the right auricle is the primitive atrium, and the crista terminalis, a crest that separates the trabeculated right auricle from the smooth sinus venerum, corresponds to the sulcus terminalis, is a groove on the exterior of the heart, and the pectinate muscles projects from the crest of the to the auricle. Lower part forms the inferior vena cava and valve in the first fetal heart, and this disappears after the birth. functions to direct blood to form a foramen ovale. And now the arterial system it includes the aortic arches, and the paired dorsal aorta will eventually unite to form the descending aorta. And aortic arches, the aortic sac, they gives off the vessels to the pharyngeal arches that gives to the develop from the weak 4. An artery they develops within each pharyngeal arch, and each of which meets the aortic sac. 5 or 6 pair of the aortic arches they are formed. Aortic arches they joins the dorsal aorta at the each side. The aortic sac they divides to form the right and the left aorta. Aortic arches and their resultant arches. First aortic arch pairs the maxillary artery. Second aortic arch pair is the disappears, and third aortic arch pairs they forms the common carotid, external carotid, proximal part of the internal carotid, and right proximal part of the right subclavian artery, and left arch of the aorta. And the fifth aortic pair it also disappears, and sixth aortic arch they forms the right distal part of the right subclavian artery and the right proximal pulmonary artery and the left distal ductus arteriosus. The ductus arteriosus it becomes ligamentum arteriosus after the birth, and closure is stimulated by the bradykinin. The distal part of the internal carotid is formed by the dorsal aorta, and the left subclavian arch they forms the seventh in intersegmental arch, which is a branch of the dorsal aorta. Right dorsal aorta disappears between the seventh intersegmental artery and the start of the fused dorsal aorta. The path of the recurrent laryngeal nerve is different on the both sides due to the different arrangement of the six aortic arch pair. The left nerve they hooks under the ductus arteriosus. The right nerve they hooks under the right subclavian artery. The vital line artery they supplies the yolk sac, fuses to form the coelomic artery, the superior mesenteric artery, and the inferior mesenteric artery, umbilical arteries. Umbilical arteries they supplies the deoxygenated blood from the fetus to the placenta, arises from the common iliac arteries, and after birth the distal portion of the artery they obliterates to form the medium umbilical ligaments, and the proximal portions they persist as the internal iliac and the ventricular arteries. So venous system, at the week 5 of the embryonic life there are the three major sets of the veins: the umbilical, the vital, and the cardinal. The umbilical veins they initially they are the two umbilical veins. Both proximal portion disappears, and the right distal portion they disappears. The left distal umbilical vein they connects with the ductus venosus to bypass the liver, and after birth becomes a ligamentum teres, and lies in the falciform ligament. And ductus venosus they connects to the inferior vena cava, and after the birth becomes a ligament. And it includes the azygous veins and the supracardinal veins and the subcardinal veins, and becomes progressively asymmetrical, resulting in the right side dominance by the week 7, leading to the formations of inferior vena cava, which includes the supracardinal and the subcardinal veins, and the left azygous veins becoming the hemizygous veins, and a resultant left to right the shunt. So this is it for today's video. Take care till the next video.